I'm Dr. Kunal Krishna. I'm a cardiothoracic and vascular surgeon. I'm at present posted as assistant professor in AIIMS, Patna. So, on the occasion of World Heart Day, I'd like to give some tips about healthy diets for a healthy heart. What happens is, as most of the people know, the risk factors for various cardiovascular diseases are hypertension and diabetes, which are taken care of by your local physician also. But an important part which has to be taken care of by the patient himself is about his healthy diet. Okay, so what is a healthy diet? A healthy diet is a healthy diet. So to start with, we should have whole grain foods like wheat, brown rice, barley. These form a part of whole grain foods. So what these do is they have a huge fiber content in them, and that prevents absorption of large amount of carbohydrates in our diet. So because our requirements is to maintain a basal metabolic rate and daily requirements, we don't want extra carbohydrates which gets converted into fats and that gets deposited in our blood vessels and coronaries, resulting in cardiovascular disease. Second most important is reducing salt intake. So salt forms an important part in controlling your hypertension. The more you take the salt, more fluid and those things get absorbed in the body by kidney, and this results in hypertension. So we should avoid taking extra salt in our diet. It's recommended that about 5 grams of salt intake daily in our diet is adequate, but most adults usually take not more than 1.5 grams of sodium a day. So less sodium you eat, the better the blood pressure and a better control of blood pressure you should have. These days we see very young adults coming with hypertensions. So that is basically because of junk foods which we eat in our diet, which has a lot of additives. So now watch your fat intake. So these junk foods basically contain a large amount of fats, which contains mainly LDL and trans fatty acids, which are very dangerous fats. The good amount of good fat is called as HDL is called as a good fat, and these LDLs, saturated carbohydrates, and those things they do what they do is they decrease the level of HDL while increasing the level of LDL. So which is the bad cholesterol. So that should be reduced in our diet. So we should avoid taking large amount of fats in our diet. They should be more of carbohydrates and fat fluids. But replacing fat with carbohydrates is not recommended. Fats don't replace fats with sugars or refined carbohydrates. So again, these what they do is in the normal diets which we take as junk food these days is bread, pasta, pizzas, which have unrefined and opt for unrefined whole grains like whole wheat, multigrain bread. We should opt for these whole wheat, multigrain bread, brown rice, barley. So these have, as I said, large amount of fatty fibers which prevent these absorption of extra carbohydrates in our diet. Now, lastly is high fiber foods. High fiber foods like your regular fruits, salads, and those things. So what they do is again they prevent extra absorption of carbohydrates in our diet, and they should form an important part of a diet to prevent extra carbohydrates. In addition to this healthy diet, we should avoid large amount of fasting, long hours of fasting, and then binge eating. What happens is it reduces our basal metabolic rate at a lower side. So whatever binge feeding you do or uncontrolled diets when you have, so these all gets absorbed and stored in our body because our basal metabolic rate becomes set at a lower side. So try to take food at regular intervals, small amounts, healthy foods, high fiber contents, low amount of refined sugars, low amount of fats, restrict your salt intake, and that should be good for you. Regarding non-vegetarian foods, eggs are very good. It's not dangerous to eat eggs. Red meat should be avoided. We can't say to stop it totally, but you should restrict it to very less quantities. Fish is better, and to some extent chicken. but poultry feeds. But you should avoid taking red meats. That's all we have today for a healthy heart. Thank you.